family-run store in Riverview, Florida. We are a baseball and specialty store with an emphasis on youth team sports. The COVID shutdown of Hillsborough County baseball and softball fields has cut our sales by 95%. We have managed to survive by selling some items, baseball, softball, nets, through local media posts with local delivery. However, my business cannot survive and will not survive like this. I'd like to see the EPG prepare a plan to reopen the fields as soon as possible. The opening of local fields for baseball, softball, soccer, lacrosse, and football to organized leagues is very important, not only to us at Fishhawk Sporting Goods, but to the hundreds of thousands of young people and their families in this community, both from a mental and a physical aspect. These are children that have not seen friends, teachers, teammates, coaches in over 40 days. They have had so much taken away from them this year. Let's try to make life somewhat normal again. The opening of the fields is a great place to start. The fields can and should be open with a simple safety guidelines in place. Evidence suggests that the younger people have the least risk to the virus. In addition, games and practices are held outside in the fresh air, which makes organized sports a much lower risk.
Mr. Bohan, your 2 minutes are up. Thank you. Mr. Bohan, your 2 minutes are, your 2 minutes are up.
He still has 20 seconds.
Okay. Do you have 20 seconds? Go ahead, sir.
Well, what I'm trying to say, with the guidance of the EPG here, we should allow the fields to be open. And I mean, this is very important, not only to the kids, to get life somewhat normal again. That's what the emphasis of my whole call is here for. So I'm just asking that you guys move forward, provide the guidance as needed, and we can get the fields and get the kids out there playing again. And that's what we need.
Thank you.
Thank you.
Thank you, sir. Thank you. Janet Nguyen.
Hello, this is Janet Nguyen from the Tampa Bay Young Republicans. Yesterday, the governor stated many facts about how low the number of COVID-19 cases has been in Hillsborough County. Included in his statement was phase 1 of a plan to start reopening Florida. There are many small businesses that may not have had to close permanently yet, however, are days from having to do so if they're not allowed to reopen. There are many people with illnesses and health conditions other than COVID-19 who deserve the right to see a health professional. If we continue to keep medical facilities closed, we're going to start to see more deaths from lack of medical help and from the virus. Additionally, at this point in time, parks and beaches are essential to our physical and mental health. If it's going to be a while before life is completely back to normal, it's important to allow people to have somewhere to go for recreation. At least begin by opening back up our parks and beaches. Trust the people to be responsible for our own health and actions. We're capable of washing our hands often and staying 6 feet away from each other. We're requesting a vote on a reopening plan today, since Monday is 2 business days from now and time is of the essence. Thank you for your service on the commission and for your time.
Christopher Verkulen.
This is Christopher Verkulen. Good afternoon, EPG. Again this week, my fellow citizens and I comment on this meeting without an agenda, and before we have a chance to hear the actions the group is proposing. We don't call in to hear ourselves talk. We're here to communicate to our elected officials how the policies they propose to affect our lives and provide a perspective that may not have been considered. We would also appreciate our statements being taken into account during discussion. The curfew debacle could have been avoided if this would have been taken into account weeks ago. To compound on what an earlier caller said, we need to allow people to return to being able to conduct their lives. It's a matter of financial stability and mental and physical health. And this is aimed at you, Mayor Castor. Placing and maintaining restrictions on activities that are entirely safe, especially keeping parks and recreational facilities closed, because it would be difficult to enforce social distancing otherwise, is not a proper principle of governance. This is not Minority Report. We don't punish future crimes. Lastly, the group needs to evaluate how it classifies risky or dangerous behavior. We've seen the lethality and reported potential fall dramatically short of projections in the last few weeks. We need to start acting like it. I'll say it again. The average Tampa resident comes in contact with 2 to 3 people on their commute to work, and the average New York City resident comes in contact with 600. We've never had the elements for a spread like theirs, and that should have been taken into account from the start. Our goal has always been to keep the hospital system from being overwhelmed, not to eliminate the virus, not to keep infection count as low as possible. Those are not realistic. Any measure that exceeds that goal is a waste of potential productivity and encroachment on the freedom of your citizens. Thank you for your time.
Tina Eloan.
Hello, can you hear me?
Yes, ma'am.
Hi, this is Tina Maria Loyan, and I am the owner-broker of Florida Commercial Group here in Tampa, Florida. I own a boutique real estate company that influences Tampa Bay as well as Ybor City. I've been told from fellow citizens to please encourage the city to lift the restrictions on the city grant so that restaurants can qualify, remove stipulations of 5 employees or less, and lift the income maximum on this funding. It was not written correctly and has inadvertently hurt small business owners. People want to go back to work and go back now. In my regards, I've actually been working from day one. I put stipulations in place here where we're all very conscious of staying safe, keeping clean, keeping our environment clean, and I think that others have the right to police their businesses themselves. I feel that myself and others feel that our rights have been taken away from us, and it's just not good for the whole to take away your rights and have no, we have no idea when we're going to be open. Small businesses were inadvertently affected because many were not in the first rounds of the PPP loans. And then when they're offered to them now, many of those that are getting unemployment, it's getting a lot more money. So therefore, it's not helping the small business owner at all. And many of them are not even going to be able to reopen. So we're asking that you please lift this immediately and allow us to open up, police it ourselves. Now, Ybor City is a whole nother entity, and many of the communities around Tampa are in their own entity. So we need you to help us round up our leaders of those communities, especially in Ybor City, where people do come together in large crowds. We need you to help us with how we need to police it, how we need to have point of entries. Can we bring the restaurants out into the 7th Avenue, let people sit down and enjoy the camaraderie among each other?
Ma'am, your 2 minutes are up, ma'am. Ma'am, your 2 minutes are up. Thank you.
Thank you.
Kathleen Thomas.
Good afternoon. My name is Caitlin Thomas. I'd like to ask 2 questions today. First, the EPG is asking for public comments for the first 20 minutes, but is not giving feedback to those of the community they serve. We would like our comments not only to be heard, but to be addressed. Secondly, this question is specifically to the medical staff on the EPG. What is the known protection level factor of homemade masks? If that information is not known and offered to the public, how is it substantive that Hillsborough County officials recommend people to wear homemade masks and private institutions mandate people to wear homemade masks that offer no validated form of protection? I have found research that states cloth masks are not engineered to filter virus-sized particulates or prevent moisture retention. This data concluded that wearing cloth mask opposed to a surgical mask is shown to increase risk of infection. If homemade masks are going to continue to be recommended, what type of training is offered to the community you serve to properly wear the mask and its use? Without proper training, how are you ensuring families understand mask capabilities and parents understand that masks are not intended for young children? In addition to those with breathing issues or other compromising medical issues, even those with facial hair or disfigurement. Most wearers do not know how to properly don and doff a mask. Most wearers do not understand proper practices to avoid mask contamination. Homemade masks are made from unknown types of fabric that do not have a validated protection value. Please note my questions are to bring light to the accuracy of ensuring safety and health for our community members. I personally ask that our government officials commit to the health and safety of all of our community members to do their due diligence, not to share misinformation or misleading information. I personally want everyone to stay safe, stay healthy, seek expertise from subject matter experts. Thank you.
Philip Reynolds.
Chairman Miller, this is Chris Lamprey with the communications team. That was the last caller that was able to call in the allotted time.
I'm sorry, say that again.
That was the last caller that was able to call in before the cutoff time. Everybody else signed up was not able to call in.
Okay, very good. Thank you. Thank you. The 20 minutes are up. So we now move into public health update. Dr. Holt, good afternoon.
Sure. This is Dr. Doug Holt, Florida Department of Health, Hillsborough County. I will review the latest epidemiology. Kevin Wagner will then also provide the more detail. And I will also update on those public health capabilities that were outlined on Monday that are needed as we reopen. Epidemiology-wise, the 14-day trajectory has decreased about 20% over the week prior to this one. Percent of positive testing has remained positive, similar at 6%. While our testing numbers returning are flat, they do not reflect the recent increase of testing that has occurred over the last several days. We had 2 new deaths. We now have 23 reported of Hillsborough residents. The hospitals, there is a slight increase in the number of people in the hospital, most of them in the non-ICU population. We're making good progress on the 3 public health capabilities that we will use as we begin to reopen, as outlined by Governor DeSantis. The long-term care facility rapid response team is already having faculty doing the shadowing so they can develop a curriculum for their students and nurses that will join and be part of our team to respond to any case in a long-term care facility. Dean Peterson has identified 20 volunteers from the College of Public Health. We expect to begin training them, orient them, and begin to put them to work next week. And as noted, I think our testing has increased significantly. So with continuation as we improve and strengthen these efforts, we are becoming better prepared to meet all the needs to both identify and respond if we see a second wave. I'll stop there.
Okay, thank you, Dr. Holt. Mayor Ross, you recognize.
Thank you, Chair Miller. First of all, I got off and I missed the roll call, but I've been back on since public comment.
Okay, sir.
So, Dr. Holt, can you tell us how many people are currently in the hospital, please?
I'm sorry, number in the hospital?
Yes, sir.
48.
Thank you.
Ms. Dibney, you recognize.
Thank you, Chair. And I apologize. I just wanted to ask a question or point out that I thought we had 20 minutes of public comment set aside, and that was only 10 minutes. Are we out of speakers?
No, I was going to get back to that after Dr. Holt finishes comments. I looked at my clock also, and that was 10 minutes. We set aside 20. Okay. I was going to go back to see if we can go back to those people and see if they're still on the phone, because we cut it off at 10 minutes, not 20 minutes. So as soon as Dr. Holt finishes, I'm going to go back and do that. Mayor Lott, you recognize.
Thank you, Mr. Chairman. Dr. Holt, thank you again for being here today with your report, your data, and so forth. I have a couple of questions for you, if you don't mind. Our governor laid out a plan yesterday, and it's obviously a phase 1 plan. And with you being our main resource from a medical standpoint to this EPG, my question for you is, do you support the phase-in plan that he shared yesterday at 5 p.m.?
I certainly do, sir.
Okay. And with that plan, you believe that we'll continue to stay in where we're at right now, where our medical facilities are not at risk of being overloaded. Is that true, sir?
What we're doing with the hospitals and in partnership with the College of Nursing is to ensure that. I certainly can't guarantee anything, but I can guarantee we will be ready because we will identify our cases early. We will isolate and track down their contacts, and we will also respond rapidly to any cases in long-term care facilities, which right now represent the greatest threat to our hospitals.
So if we can expand on that a little bit. So one of the things I'm really intrigued with, and I think that we've done a really good job in our state with, is the trace data and so forth, where we can see where there's a potential rise in the numbers. When we said that potential rise in the number from that data, how would you go about, responding to that particular flare-up in the community and putting it out?
Well, that's where we would utilize our a mobile team or resources to go directly into that community, promote testing. With the increased lab or turnaround time being reduced, we're able to identify the positives and do exactly what we need to do, which is reach anyone they might have been exposed and do everything to prevent them from spreading it to anyone else. As I referred to it, I think in the past, break the chain of transmission.
Okay. So based on the numbers we have right now and based on the governor's recommendation and your recommendation for us to move forward with the governor's plan, you don't see any reason why we wouldn't support the governor's phase 1 plan. Is that correct?
I certainly fully support the plan, and I believe that we must move forward to reopen.
Okay. Thank you very much.
Mayor Castro, you recognize.
Thank you, sir. I don't know if this is a request or should be crafted as a motion, but I would like, instead of the reports that we get, just saying how many tests we've done and how many positive cases we have, that Dr. Holt presents every week the testing goals, which I think were laid out the other day at 2,250 a day. So with that goal, the number of tests that we are providing every single day, and either a weekly or daily report sent to us at the EPG. And then also the framework for the contact tracing, like exactly what that layout looks like, and then a report on how effective we've been at the contact tracing, because I'd have to disagree with Mayor Lott saying we've done a great job of that. As we ramp up the tests, as we heard, we're going to have the 200 individuals that are doing those contact tracing, and I think that that's imperative as well. And then next is to, again, have the syndromic surveillance system that Dr. Holt and USF have created, so that we're familiar with that, and then have a report too is presented at the emergency room and the physician's offices, and then what is presented Hillsborough County USF survey that's been done. So we have the GIS mapping that will identify those hotspots that we can respond to. I too support the governor's reopening plan, but we have got to have the information, the data on the number of tests that we're giving, the number of positive tests, and most importantly, what hotspots are, so that we can respond quickly to those. I don't want anyone to think that this is the end right here. We are going to have more positive cases as we open up. The goal is to be able to manage those and to be able to protect individuals that are at high risk. So, Dr. Holt, would you feel more comfortable with that as a motion or as a request to have those reports either sent out to the EPG members or the presentation, at least at our meetings, our public meetings?
I don't know if it's my decision, but I have always tried to be fully responsive and informative to any request, and I will certainly honor every one of those that I'm able to do. Some of them will require some contributions from others, particularly those that are collecting the test.
Do you feel that you're not getting that information right now from the testing sites in a timely manner?
No, I wouldn't say that. I just really have not been that focused. That's I have not. That's not been a responsibility that I have been assigned to lead on.
Okay. Okay. All right. Thank you, Chair. I can follow up with you, Dr. Holt, after the meeting. Thank you, Chair. That's all.
Welcome. Commissioner Merman, you're recognized.
Thank you, Mr. Chair. I just want to ask Dr. Holt, did we test 300 tests this week, or do you know what the numbers are? Will Kevin have those in his presentation?
He usually does. Yes,
so
according to my, there's two questions, two answers, I guess. My answer is I know how many results that came back. Mr. Dudley should be able to tell you how many tests, at least from Raymond James. The missing elements, I think we've talked about a lot, and any of our other publicly supported sites. The missing elements have always been sort of those that are done in the community, whether they're done in the hospitals or one of the private sectors. And Mr. Early and I have certainly engaged the leadership of those hospitals or healthcare systems, I should say, to work with us to receive that data, and they have been responsive.
They have. So is there a central repository now for everybody to report their testings and the positivity and all that? Is that kind of where we're headed?
That is the goal. We are we started with the survey, and we are now going to follow that up with additional meetings, and that would be our hope, and I believe it is our shared goal to work with them to achieve that. I can't tell you what that will require, but we'll certainly, that's our goal. I'll stop there.
Okay. I mean, I think the issue is we get the information about 300 tests a day. We want to get up to 2,200 tests a day. That we don't know how much is going on in the private sector, so we really don't know. And then we've got the positivity, negativity issue related to the tests. So I guess it'd be great if, again, data drives our decisions. If we have more information like what Mayor Castor was saying, it's going to make us feel a lot more comfortable, number one, when we have hotspots, and number two, when everything is fully open. Thank you.
Mayor Lott, you're recognized. Mayor Lott?
I thought I already took my hand down. I apologize.
Okay, all right. Mr. Merrill, you're recognized.
Yeah, just to follow up on that, Gene Early is working with all of the healthcare systems, and in particular with PGH, to build the database that you're looking for. So what we've been presenting to you so far at EPG meetings, does report what we know. And Kevin Wagner's reports show that. But when Gene does finish compiling it, I think it will be responsive to
awesome.
To both to all the requests that you've made.
Right, that's what we're looking for. Thank you.
Dr. Holt, was there anything further in your presentation?
No, other than turning it over to Kevin to do the more detailed epi.
Before we do that, we cut the public off at 10 minutes and it should have been 20 minutes. And I don't know if any of them were still on the phone or not, on the line or not. Let me revert back to public comment. Is Philip Reynolds on the phone?
Chairman Miller, this is James Brewer.
Yes,
Communications received 10 submissions for public comment. 5 of those submissions have called in and spoke. Therefore, we received only 10 minutes of public comment. At this time, the remaining 5 speakers have not called in to present their public comment. We will keep the line open to receive their call, but at this time, the remaining 5 had not called in.
Okay, but we set aside 20 minutes and we only did 10. That's the point. So the other 5 would have been 10 more minutes, which is giving us 20, and we didn't get to those. So
correct, sir, because they did not
be able to
call
get
in.
back to those people. So they did not call in, so that's why we cut it off at 10. Is that what you're saying?
That is correct, sir. The remaining 5 speakers did not call in or are not available to speak at this time.
Okay, very good. That's what I was trying to find out. All right, thank you very much. Emergency management update, Mr. Dudley.
Good afternoon.
Kevin Wagner. Wasn't Kevin Wagner going to give his report next?
No, Mr. Dudley's there.
Oh, okay.
All right. Good afternoon. We continue to support home testing and operations at remote collection sites, Raymond James, Lee Davis, South Shore, and Plant City. We have over 9,800 collection kits on hand to support ongoing operations. We've tested over 6,300 to date between the 4 sites. And as of Wednesday, close of business yesterday, between the sites, we've had 1,267 collections. As of 11 a.m. this morning, we have 1,289 appointments scheduled for today through Friday. As of 11 a.m., we also have 748 appointments scheduled for the following week, and I'm sure we'll have more on the books by the end of the day once they close operations at 5. We continue to support the county quarantine and isolation sites. We have no guests at this time at the quarantine site, and we have 5 guests in the isolation site. We continue to also support logistics operations. We've submitted over 1,700 requests to the state. We have distributed more than 195,000 gloves, more than 475,000 masks, more than 38,000 face shields, and over 6,700 gowns to date. We also continue to support the donations management warehouse. As of today, we've received more than 18,000 masks through donations. Since our last week, Hillsborough County has received over 10,000 responses to our survey about COVID-19 testing. This concludes my update.
Are there any questions? I don't see any questions of Mr. Dudley at all. Thank you, Mr. Dudley. Mr. Wagner, Mr. Wagner, did you have a presentation?
Yes, Chairman, I do, sir.
I'm sorry, go ahead. You recognize.
Thanks, sir. All right.
Mr. Wagner? Mr. Wagner? I think we lost Mr. Wagner.
Chairman, this is James. He did drop out of the session, sir.
Okay, all right. Well, we'll move on and let me know when he comes back.
Looks like he's joining currently.
Pardon?
It looked like he just rejoined currently.
Mr. Wagner, are you there?
Apologize for that. My system locked up.
Okay.
Let me go ahead and bring this back up. I apologize. You are seeing my presentation now, sir?
Yes, sir.
All right, thank you, Mr. Chairman. Again, Kevin Wagner, Business Analyst for Healthcare Services Department. Alluding to the conversation earlier, and we agree with Mr. Merrill, staff has always tried to present all the data that we know. Through my presentation so far, we've talked about Florida, we've talked about Hillsborough County, as well as some of the demographics of Hillsborough County. That information is still being collected, but this one today is a little bit shorter, a little bit more concise, focusing on the positivity and negativity results as outlined by Dr. Holt. From a high-level standpoint, to date, on through 4/29, the test results that have been filtered back in is 19,742, which represents, all the ones that have come in so far. Of that, 18,600, a little bit above, have been negative, about 94%, and just under 6%, 1,100 of them have been positive. So again, from a macro level, the positivity negativity level is very well at a 94 and less than 6% level. Alluding to the conversation earlier about the daily test results and the daily new cases, this is what's being presented on this slide. The blue line indicates the number of test results that get filtered back in that are updated on the FDOH report per day. As you can see, we've had high of nearly 900 and as low as nearly 200. So again, there's a lot of variability in those test results, which goes back to the conversation of testing with the hospitals and the private labs and getting those results in quickly. But the trend line, as we showed, I think last week, is fairly flat. We want to get higher, we want to flatten or higher the line of the test results getting back in, being test issued and getting those results in quickly. Bottom line of that green or the red dotted line is the trend of that. That is the number of new cases, positive results per day that are reported for Hillsborough County. So again, there is variability. High of 51 in the last 2 weeks with the low of 7 or 8. I point to the tail end on the right side of that green line. The last 3 or 4 days, we've had 7, 14, 18, and 25. That's not a trend per se, but it's something that we will keep on watching because those are the cases that are getting positive and as they're returning in. But overall, the trend line for positive cases in Hillsborough County is slightly going down. But again, we don't have a lot of positive cases. This is over the last 2-week period. Now, as we've talked about positivity and negativity, there's been so much conversation of what's the trend. So what's presented here is the 7-day trends by week. Starting on the far left is 3/29 to 4/4. In that week, of all the test results, 90% came back negative, 10% came back positive. The following week, 94% were negative. The following week, 95%, and 97 and 96% is the current week. So again, the trending of the positivity and negativity results are key. The blue line is trending higher on negatives. That is what we want to see. The red line at the bottom is trending lower. That is what we want to see as well. So again, that's how we are looking at the 7-day macro level between the positive and negatives. When we step back even further, another layer down, we went 7-day. This is the 3-day represented. So again, you're seeing a little bit of, on the left side, an 86% was negative, 14% was positive. That was on April 1 to April 3 in that 3-day range. But again, looking at the tail end on the right side, we have 98%, 96%, 94% were negative as well. So by and large, the county has been mid-90s and higher at a negative rate. Again, that trending is higher, the direction that we want to see. And on the positive side, that is trending lower, which is what we want to see. This last week of the tail on this presentation is not being completed yet, so we'll see where we finalize in the last week. We've done 7-day, we've done 3-day. This is the daily. So again, no little bumps overall, mid-90s and the upper 90s. You see a positive trend with everything presented. on the data by each day. So again, yesterday was 93%, the previous day was 96 and 97 and 99%. So again, we are looking for the testing, getting the results in quicker, and having a continued high negative result for the trending in the results that are received. When we talk about testing, the very first slide of this was 19,000 tests that have been reported, equates to about 1.34% of the population. You know, there's been a number of conversations about trying to get to 2% higher. This is where we stand right now, based upon the results that have been received to FDOH. Not the number of tests issued, but the results have received. About 1.34% population tested, and the other 98% has not been tested. And again, I can't account for individuals who get more than one test. And that's all I have. If there's any questions, I'll stop there.
Thank you, Mr. Wagner. I don't see any questions, sir. So thank you very much for your presentation. We'll now move into the county attorney's update. Ms. Beck.
Yes, good afternoon, EPG board members, Chairman Miller and Chairman Miller. This is Christine Beck, the county attorney. And in your backup materials, you received 3 documents. These were released last night by Governor DeSantis. The first document was the plan for reopening and guiding principles. The second was Executive Order 20-111, and the third was Executive Order 20-112, as well as new FAQs to go along with understanding that order. I will focus on the orders and provide a brief summary of each of the orders. Order 20-111 extends the orders numbered 20-87, 20-91, and 20-92 until 12:01 a.m. on May 4th. The order 2087 was exclusively relating to not allowing vacation rentals, and so that order has been extended till May 4th. And then orders 2091 and 2092 have been the orders that we have been following since they were issued by the governor, and they set out the essential services and activities. You will recall that Order 2092 had the language that the governor's order supersedes conflicting local orders. Without the extensions contained in Order 20-111, the orders would have expired today. So this 20-111 essentially just carries you over until Monday. Order 20-112 is actually where most of the substance of the new actions by the state are reflected. And this order takes over as the controlling order in Florida, with the exception of Miami-Dade, Broward, and Palm Beach counties, and it becomes effective at 12:01 a.m. on May 4th. I would note that the new order from the governor, the 20-112, no longer includes language superseding conflicting local action or orders. 20-112 reinforces the principles that were set forth in the governor's prior orders relating to essential services and activities, and those all remain allowed, provided that CDC and OSHA guidelines are followed. And as to senior citizens and those with underlying health conditions, they are now strongly encouraged to stay home. And a few more general points under Order 2012. Local jurisdictions are to continue ensuring that groups greater than 10 are not permitted to congregate in public places if social distancing cannot be maintained. All persons should continue to avoid non-essential travel. All persons should adhere to CDC guidelines and travel restrictions. And orders, some other business that was taken care of, or 3 different orders were also extended. These relate to airport screening and travel-related issues. The most important parts, I think, for this group are set forth in sections 3 and 4 of the orders. And section 3 is new action taken by the state that addresses previously restricted businesses. And in sections
3, bars, nightclubs, and pubs must remain closed. Restaurants may open if they adopt appropriate social distancing measures and if they limit their occupancy to no more than 25%. And in addition, outdoor seating is permitted, provided there is a 6-foot distance between parties, and parties can be no greater than 10. Gyms and fitness centers remain closed, and vacation rentals are still not permitted. Moving into section 4, which is titled as an affecting other businesses, this section provides that retail may open storefronts provided there's no more than 25% occupancy and social distancing is followed. And in addition, the governor allows museums and libraries to open at 25% occupancy. But this is only if it's permitted by the local jurisdiction. With regard to museums and libraries, interactive components, however, must remain closed. Section 5 is addressing medical issues, and this new order now allows for elective surgical procedures to resume. And surgical centers, dentists, orthodontists, endodontists may open and perform procedures under a listed set of conditions. And finally, in Section 6, the Order 112 extends Order 2069, and this is the order that permitted virtual meetings such as the one we're having today, and that order has also been extended. So with that summary, I'll be happy to address any questions.
The order that the governor, the executive order that takes effect Monday morning at 12:01, that's 20-112?
Correct.
Okay, the order that he put forth that was a safe at home, that does not expire until 12:01 Monday morning?
Correct, because of Order 111 actually extended it just to carry it forward so that there would be coverage through the weekend.
Through the weekend, okay. So 2011 extended the safer at home until 12:01 Monday morning, and then after 12:01 Monday morning, 20-112, which is the one he talked about yesterday, goes into effect.
Correct.
Okay, all right. Ms. Nyberg, you recognize?
Thank you. Yes, thank you so much, Chair. So over the last several days and weeks, we've had the opportunity to review a lot of data provided to us by obviously many public health officials, a team of experts. Some of us have also been researching financial experts who are forecasting, the impact of what this pandemic is going to have and continue to have on our local and state and national economy. We've also received a lot of communication from our constituents who all of us represent, and we want to make sure that we let everyone know that we are listening to the feedback that we're getting from the citizens of the county. So in light of the governor's announcement and the execution of a new order at 12:01 on May the 4th, I think that we need to, as the EPG, take some action today and maybe make some decisions which help to reopen our communities as well as our local economy. There's been a lot of confusion about some of the orders. I know there was a recent order that was extended by the county that just was for county buildings and locations under the administration of the BOCC. I think we need to offer some clarity and some consistency and some continuity in whatever we decide today. So with that, I wanted to ask Ms. Beck for her advice as counsel on perhaps two different scenarios that we could consider today. One would be to rescind our current safer at home order and allow the obviously the governor's order that takes effect at 12:01 on May 4th to take obviously to take effect. That's what we would have to be under that order as a state order. Or would it be wise to continue the safer at home order until 12 a.m. Monday morning and until the governor's order takes effect at 12:01 a.m.? What would offer the most consistency and clarity for our community? Could you kind of give us your advice on perhaps those two different scenarios?
Yes, Ms. Snively. If the EPG board was interested in rescinding our local safer at home, which, as we know, we were following the governor's order anyways, but that order was out there. If you wanted to rescind that for clarity purposes, my best advice, I think, would be to have it be effective concurrently with when Order 112 takes over, which would be at 12:01 a.m. on May 4th.
Okay. And just to clarify some of the reasoning for our current order to be in place and stay in place, because I know that there could be some potential financial ramifications to our county if we don't have an emergency order in place. Is that am I understanding that correctly? Is that one of the benefits of keeping the order in place is for financial relief to our county, having that emergency order in place?
So the safer at home order doesn't have a relation to that, but just having our local state of emergency order in place might. That would be something I would recommend that we have staff comment upon. I have heard from various emergency management personnel that having an emergency order in place facilitates work that is done to obtain FEMA reimbursements and so forth. So that's my only comment with regard to having a local state of emergency order. But there would not be the same concern with the safer at home order.
Okay.
This is Tim Dudley.
Pardon me?
This is Tim Dudley.
Who is this?
Tim Dudley.
Mr. Dudley.
Mr. Dudley, you want to say something?
Yes, in response to that local state of emergency, I just wanted to remind the EPG that that is correct. We do still currently have ongoing operations at Q&I sites, the collection sites. This LSC helps us to remain agile to make those emergency purchases as required to continue supporting emergency operations.
Okay. Thank you. And so may I respond to Ms. Beck on that as well, Chair?
Yes, go ahead. Okay. You still have the floor.
Thank you so much. So the emergency order would need to stay in place. And your recommendation, if I just to be clear, would be to only extend the current order through Monday at midnight, where then at 12, and then let it expire, so we could vote to let that expire at midnight, and then the governor's order would take place at 12:01. So if that is correct, then I would move to extend the order and let it expire. Yes.
Yeah, maybe just to be clear, I want to make sure we're talking about each order separately. The order that we have been renewing every 7 days, I'll just refer to that as the order, continuing the declaration of the local state of emergency. And I think that's what Mr. Dudley was referring to, that allows for emergency purchases and a lot of the benefits that you have. And so as I was hearing him, I think the recommendation would be to keep the local state of emergency order in place. And that one is due today to be, is up again today, will expire today if it's not extended. So that's that issue. With regard to the local safer at home order, we did not put a ending date in that order. It didn't have it didn't expire at any particular time. And so that's why I said that if you believe that it would be less confusing to the public to just be operating under the governor's order and not have our order in the mix, you could rescind that order. And again, for clarity purposes, it might be best to just have it be effective as of 12:01 a.m. on May 4th.
Okay, so to rescind the safer at home order at 12:01 when the governor's order takes effect.
Yes.
Okay, so so Chair, if I may make the motion to do that, if you would entertain that motion, that's what I would recommend for us to do today, is to only extend the safer at order. I'm sorry, only extend the safer at order until the governor's order takes
safer home order.
So, thank you, safer home order. Sorry, until the governor's order takes effect.
Okay. All right. There's a motion. There's a motion.
I'll second.
All right, Ms. Snively, is there a second?
There's a second.
Oh,
okay. Now make one thing perfectly clear. Okay, I got it. To make things perfectly clear with her motion is to extend the safer at home order until 12 midnight Monday. And that's when at 12:01 the governor's new order comes effective. People have gotten confused because the press got it messed up. This does not pertain to the May 15th order that was set out by Mr. Merrill that says that county buildings will remain closed and employees who are working home remotely will continue to work remotely. So I want to make that perfectly clear because it was all messed up by the press this week. So are we understanding that? Okay. Commissioner Merman, you recognize.
Thank you, Mr. Chair. Yeah, I was actually, Ms. Snively said a lot of the points I wanted to make. I think the major point is, and the public probably doesn't know this, the governor's safer at home order expires today. And that's why, is that correct, Ms. Mack?
It does expire today. However, Order 111 extended it until Monday. So the idea would be that that the governor's order is in place until Monday, but then Order 112 takes over.
So then why do we need to extend the county safer at home order if basically they're the same? Why would we need to do that?
Yeah, you wouldn't need to extend it. I thought the question was whether we wanted to rescind it.
Rescind
the safer at home and just have it be very clear that we're operating under the governor's order.
We always, and for the listening public, we have always been operating under the governor's orders. Always. There's no order.
This is where we get people confused.
It does. Absolutely.
This is where we get people confused.
I'm confused by Ms. Snively's motion now because I think we should just rescind the county order today and just stay under the governor's orders, and then his new one will take effect on Monday at 12:01 a.m.
May I respond? Sure.
Okay.
I think that's what Ms. Snively wants to do.
Well, and I was trying to get from, and correct me, Ms. Beck, if I'm wrong, maybe I misunderstood, but I was trying to do what would be the least confusing. And so since the governor extended his order until Monday, I thought we could do the same thing in alignment with what he was doing. I understand the duplicity, and I know it's redundant, but we've been working under these both orders at the same time anyway. So really just out of some continuity, I was just making the motion to extend it in alignment with what the governor's doing with extending his own safer at home order until his other order picks up at 12:01. So just trying to be, simplify the process, that's all. But thank you.
So I guess you're picking the least confusing motion for the public. But I can tell you honestly, they're completely confused when our county order stays in place. That's what I think. So I'll wait and hear from the other members.
Commissioner Merman, if we rescind our order today and the governor's order stays in place, I think there'll be even more confusion. If we just continue our order, like the motion says, until 12 midnight Monday, and then the governor's 20-112 order comes into place, I think that's the least confusion what we would have. I think if we now said we're going to rescind the county's order and the governor order stays in place, there's going to be a lot of confusion. That's the way I see it. Maybe I'm wrong. Go ahead, Commissioner Berman.
Okay, well, let's listen to other people, but I'm fine. I am whatever way we go, but I got to tell you, these emails that we're getting, hundreds of them every day about please rescind the county order, people are very, very confused. So I think they think our order is more restrictive than the governor's order, which it is not. And I'm trying to remove or figure out how can we remove that confusion of our county order and the governor's order, because they're never always been the same.
If the press would emphasize what we're saying and get it right, I think then we would not have this confusion, just like we had this week when Mr. Merrill said
good point.
The county government and employees would stay home through May 15th. Okay?
Good point.
Mel, you recognize.
I hear.
I definitely support this motion and the second on it. I would be okay with rescinding the vote today because our order doesn't have any, power or authority over the governor's current order. But I also support, the idea of us allowing it to run out at midnight with the governors. That way, if this body feels comfortable with it, I think it gives us all the opportunity to have one voice and come out with one voice. That the current order that's in place right now is null and void as of midnight Monday night. And so I'll definitely support this motion. Thank you.
Thank you. Commissioner Overman, you recognize.
Thank you, Chair. I'll make this quick. Ms. Beck, could you go over the governor's order for Section 2 regarding responsible individual activities and what things will go into place with the governor's order? It specifically indicates that all persons in Florida shall continue to limit their personal interactions outside of their home. However, as of effective of this order, persons shall provide or obtain all services that are currently allowed, and then it goes on. So when we talk about this citizens being confused, and we rescind our order, and we go to the governor's order, and we don't talk about Section 2 of the order, which still recommends people limit their personal activities out of their home with some exceptions. I think the press needs to understand that while we may move with this motion to the governor's orders, it still doesn't mean a lot of people aren't asked to stay at home to some extent. So, Ms. Beck, could you clarify that section for me and explain what that section is needed by our citizens to understand what they're permitted to do and not do? Thank you.
Which order are you speaking of, Commissioner Overman?
I'm reading the governor's order 112, and that's the one that goes into place at 12:01.
Okay.
Yes. Commissioner Overman, I will do my. I'm sorry. I will do my best to try to address that. The way I read Section 2 is that it continues with the provisions that were in the prior order 20-91 that put limitations on individual movements, and individuals were only authorized to go to either an essential service or an essential activity. And that's continuing to be allowed. And there's still the restriction for strongly encouraging senior citizens and those with underlying health conditions to also stay home. The governor's order has always been premised on individuals as opposed to businesses. So that part of the order is is consistent with his prior order, in my opinion. What this new order does, what 112 does, is it's opening up more of Florida, and it's allowing individuals to go to now restaurants and other places that previously may not have been permitted. I'm not sure if I answered your question, but I'll try again if I missed it.
I think it's just important to recognize that when the people here rescind our safer.
Mr. Overman?
I'm sorry. Am I recognized? I'm coming back to Christine Beck's response.
Yes, go ahead.
Okay. So I think it's important for people to hear that if we rescind our safer at home order and we adopt the governor's order, there's still some restrictions on actions. It's not, business as usual. So I think it's clear what the governor has responded to, and I think it's important that we are clear about what that recommendation for our citizens, how that stands. Because there are still some restrictions on actions that citizens, individuals, you are correct, need to follow in the recommendations associated with that. So thank you.
Mayor Ross, you recognize.
Thank you, Mr. Chair. Well, much of it has been said already. I support the motion, and I also support the idea of coinciding the timing with the governor's order. I think that makes a lot of sense. I'd love to rescind today, but that would just cause confusion. Everybody would want to say, well, Hillsborough's, business, and when in fact, we're really not. So it's a well-crafted motion. I support it, and I also support the timeline.
Mayor Castor, you recognize.
Thank you, sir. I was trying to figure out what the point of this conversation is. And it seems to me that the only difference, jurisdictions across the state have their own form of the safer at home. And the difference that I see is that in the governor's order for essential businesses, essential services, it says shall limit essential services, where ours says essential businesses must close. So that seems to be the only difference. For the life of me, I couldn't figure out why all this talk about our rescinding of the safer at home, when plenty of jurisdictions have it along with the state. And in the governor's FAQs that are attached to the order 20-112, it says, or the question presented, are local authorities allowed to adopt requirements directly on businesses, operations, or venues, including buildings, beaches, and parks, that may be stricter than the governor's executive order? And the governor's answer is yes. So is that, I would ask Ms. Snively or Mayor Lott, is that the point, the end game of rescinding this?
Who do you want to answer the question, Mayor?
Either one of us can answer that, I think. So I think the point in rescinding this is to create some alignment with what the governor's orders will be, have been, are, and will be. And I don't know that we need to continue our safer at home order if the governor is not continuing a safer at home order. So it's really just to be consistent with what the governor's orders are going to look like. So other than that, and obviously with his order that begins, it is imperative, I think, that we continue to focus on how we can reopen our community in Hillsborough County, and that's exactly what it does. If we don't rescind the order effective at 12:01 and it continues, then we are certainly operating in a much stricter environment than the governor is allowing. And I've heard from my constituents day after day and email and phone call is they want us to loosen up and they want us to reopen. And that is exactly what the intent of the governor's order 2112 does, is allows us to begin to phase in a reopening of our local community and our economy. And so really, it's to streamline what we're doing today, have some alignment with the orders, and then follow the governor's plan. We don't necessarily have to move to make a motion or vote on adopting his plan because it automatically takes place. So really this motion is just to rescind the current safer at home order at 12:01 when the governor's new order 2112 takes place. Thank you.
Castro, you have anything else?
Chair, can I answer?
I agree that, we all want to follow. We're all in agreement. Oh, did you recognize me, Chairman?
No, go ahead. You recognize, go ahead. Yeah, go ahead.
We're all in agreement, I believe, as a group in supporting the governor's reopening. I just clearly don't understand all of the discussion about this when they're not in conflict. In this conversation, we've spent so much time on this conversation that started before the governor even put an order out. So it was just perplexing to me. I just thought there had to be some kind of a logic to it that was lost on me. Thank you.
Mayor Lott, you recognize.
Thank you. Mayor Castro, I appreciate the opportunity to answer your question. I agree with school member Mrs. Snively on her motion and her rationale behind it. I don't want to repeat it, but the other thing I want to add is I don't see the purpose of having basically a redundant order. I think when you have an order on top of an order, that's where confusion comes from. And either we're going to get behind the governor's leadership and his order, or we're not. And I think that's really the question, and what this vote is about today is we've already been under his the current order that we're in place right now, with the redundant order sitting behind it. And as our governor starts opening up other phases, if we still have this order in place, then the question comes: are we a part of phase 2, phase 3, whatever phases he may have in front of him? Do we go forward? Do we move backwards as data comes out? Because he says he's making a decision based on data, not based on fear. And so I think we just need to clear the message here. And either today's vote is either we're behind the governor's order or we're not. If we leave an order in place, that means we're still sitting here wanting to possibly conflict with it, possibly put our order in competition with his order. And if that's the desire, we can do that anytime down the road. But right now, I say let's clear the road, let's clear the path. And he laid out a very good plan yesterday that we're all so far saying we're behind it. So I don't know why we'd have something that would be redundant and in competition with him. So that's the rationale behind my reason for supporting this. And thanks for the opportunity to speak. Thank you.
Mayor Ross, you recognize.
I'm sorry, Mr. Chair. I forgot to take it down.
Okay. All right. Thank you. Commissioner Overman, you recognize.
Thank you. So if we rescind this order whenever we do, Monday or today, what happens if our numbers spike differently than the trend of the entire state of Florida? How and when do we act, and what do we do if we have no concurrent order that runs alongside of the governor that isn't in conflict at this point? And I don't know who to ask that question or answer it.
Ms. Beck, Ms. Beck.
Yes, I'll be happy to address that. The mayor raised a good point in the FAQs that it's very clear that under the new Order 112, and frankly, this was also part of the FAQs under Order 2091, that local authorities can adopt requirements directly on businesses, operations, or venues, including buildings, beaches, and parks that may be stricter than the governor's order. So there is that ability as we go forward. If our numbers were to cause a reason to want to take another look or put in stricter measures, I think we would have the latitude to do that under many circumstances. We cannot alter what are deemed essential services or essential activities, but I think we have opportunities under this language to address things that may be a concern. So There is that provision, and as I mentioned, there's no longer the language in the order that says that the governor's order supersedes local orders. So I think that we would have latitude to take action to protect our community.
Commissioner Merman, you recognize.
Thank you. Thank you, Mr. Chair. Yeah, and I think that's the purpose of the emergency policy group, is to act in emergencies. And if the numbers do spike again, obviously we would act accordingly, just like we do. We have to act very quick when hurricanes come here, or they take a turn and they're headed for us rather than going a different direction. So I've always felt, I think we would work with the governor's office and make sure that we have his support going forward if we had to initiate any stricter type actions that would help keep our community safe, and like the mayor has always said, to save lives. But I think the governor's got us off to a great start, and we're finally going to attempt to get back to normal, at least 25%, get our economic machine moving again, get people back on their feet and get them back to their jobs. And that's what I'm concerned about, and hopefully we can just move forward after this vote today.
Mr. Nabi, you recognize. Ms. Navely?
Sorry. Yes, I'd like to call the question, please.
Well, you're not going to let me comment. Okay. Question has been called.
Oh, I'm so sorry. I apologize, Chair.
That's okay. No problem. No problem. No. Rules are the rules.
You're the chair. You may.
No.
I will withdraw.
No. Rules are the rules. Rules are the rules. Rules are the rules. You can't withdraw a question. So we have a motion on the floor by Ms. Snively, second by Ms. Merman. Commissioner Merman, please call the roll.
Miller?
Yes.
Overman?
Yes.
Merman?
Yes. This is gonna hurt.
Cronister?
I'll say yes. I'll say no.
Castor?
No, I see no purpose in this.
I'm sorry, what did you say?
I said I vote no. I said I don't see a purpose, so that we can tighten up, leave the order in place, and then tighten up if necessary.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
Motion carried 7-1. Mayor Castor voted no.
Thank you. Ms. Beck, you still have the floor.
Yes, Commissioner Miller, the only remaining item is with regard to the 7-day extension of the local state of emergency, and that is up to the board whether they would like to extend that.
Okay. Any comments on that? The local state of emergency? And I think that didn't Mr. Dudley explain why we needed to have that? Am I correct?
Yes, you are. In order to keep our emergency purchases and so forth, it provides that benefit as well as others.
I'll move
Commissioner Overman moves to extend the order, please.
Okay, we have a motion by Commissioner Overman.
Oh,
is there a second?
I did. I'll second. Commissioner Merman.
Motion by Commissioner Overman, second by Commissioner Merman. Mr. Merrill, did I see your hand?
Yeah, I think we're okay. I wanted to make sure everyone understands that you all have a lot to lose financially if you don't approve this, because this is the only way we recover federal dollars. So I just want to make sure everyone understands that before they vote.
Okay. Commissioner Merman, you recognized.
No, that's what Mr. Merrill said exactly what, and he's more of authority on this than I am, but no, we have a lot to lose if we don't do this.
Okay. Seeing no further hands, please, I'm sorry, Mayor Ross, you recognize.
Thank you, Chair. I just wanted to point out that the emergency order, as it's drafted, that we have in the backup material, incorporates the safer at home order and all the other previous orders in it. So the language of that, if I'm not mistaken, Ms. Beck, would need to be revised. What we would be passing would not be the draft that we've received. Is that correct?
Yes, that's an excellent point, Mayor Ross, and we would certainly make that revision to the document to be in accord with the votes recorded today.
Okay. In that case, I'm going to ask Commissioner Ullman to withdraw her motion and Commissioner Merman to withdraw her second, and have Ms. Ullman state another motion incorporating what Ms. Beck just said that came from Mayor Ross. Am I making myself clear on that?
Yes, sir.
So would you make another motion, please?
I'm
withdraw
going
your,
to.
Withdraw your first, so you withdraw your other motion.
Understood. I withdraw the previous motion.
Okay.
And Merman, do you withdraw yours?
Yeah, I withdraw. Mm-hmm.
All right, so I'll change the motion or submit another motion to approve the extension of our emergency order. We're taking into consideration today's vote regarding the order and the safe at home to begin immediately today.
Okay.
I'll second. I'd like a little bit different order.
I'm sorry, say that again?
I will second the motion, but I'd like to have it be worded differently, where it didn't just say it reflected the vote, that actually we eliminated the safer at home order.
Okay. There's a motion by Commissioner Merman, I'm sorry, by Commissioner Ullman, second by Commissioner Merman, and I think the staff will be able to clean up.
Okay, I do too.
Okay? All right, they'll clean it up. Seeing no hands at this time, please call the roll.
Miller?
Yes.
Overman?
Yes.
Yeah.
Merman?
Yes.
Cronister?
Yes.
Castor?
Yes.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
Motion carried 8-0.
Okay, thank you. Ms. Beck, is there anything else you want to bring forth?
No, sir.
Okay. Moving to EPG discussions. Is there anything that members of the EPG like to discuss at this point in time? Ms. Snively, you recognize.
Thank you, Chair. Could we get a little bit of clarification on what exactly is happening with our parks and beaches and ELAPs? And we've gotten a lot of constituent feedback, at least I have gotten a lot of constituent feedback about opening up some of our parks and some of our recreational areas in the county. And so I think there's a lot of confusion about what's open, what's not open, what the county has closed, what we have the authority to do, the individual municipalities. I know that I remember Mr. Merrill saying that there were some issues with some of the parks and some bad behavior, bad choices that people were making, some issues. But, you know, in lots of areas, especially in the more rural parts of the county, there are a lot of parks and a lot of ELAPs and places where people are easily able to recreate and maintain, you know, their social distance. And so I would love it if you could, or someone could explain what exactly is happening with the parks, and is there any opportunity for us to open up some of the parks? And I think that a few of the parks, if they're having some issues, should not should not make the rest of the parks unable to open if the majority of people can social distance and enjoy and recreate. So just wanted to open up that discussion. Thank you.
Okay, before I call on Mr. Merrill and call on Mayor Castro to talk about the city parks, and Mayor Parks about to talk about his city parks, and Mayor Ross to talk about his city parks, do understand that this body has no control over parks and trails and beaches at all. But Mr. Merrill has something he's going to talk about today that he's going to present, I think, later on. So, Mr. Merrill, you recognize.
Yes, Mr. Chair. I've got a document I'm sharing here, if we can pull that up. I don't know if you can see it. Okay.
Yeah, it's up.
This is a press release that went out, or media release that went out today. And as you can see, it indicates a two-stage opening. On Saturday, we're opening at 8 a.m. E.G. Simmons Conservation Park and the boat ramp. And then 8 a.m. Monday, we have these 4 openings here. So those are the ones that are currently affected. I was waiting until we had the governor's reopening order in place so that when we did open, we were not going to be in conflict with the governor's order. And so that's why this is being done today. And, you know, as we move forward and can apply, you know, additional openings, we will. But this is the initial opening.
Thank you, Mr. Merrill. Mayor Castor.
Yes, we will be coming out with a release tomorrow. Right now, we have 6 exercise trails that are open and have been open in the city of Tampa, and we have 4 boat ramps.
Okay, thank you, ma'am.
Thank you.
Thank you, Mr. Chairman. Yes, currently and since the beginning of this pandemic, all of our trails have been open. All of our passive parks have been opening. And next week, we'll have all our parks open in Plant City, and we'll be announcing that day on Monday on the grand opening of the rest of our parks in Plant City. Thank you.
Thank you. Mayor Ross.
Thank you, Mr. Chair. Our parks and boat ramps are all open. We have fenced off our playground equipment for obvious reasons, but the parks themselves have been open and the boat ramps are open.
Okay. Ms. Snowdy, did that answer your questions? A question?
Oh, yes, that's very helpful. Thank you so much for all of that information. I think that people will be pleased to see us, see the counties and municipalities phasing in some of the more of the opportunities to recreate in different parts of the county.
All right. Okay. Is there any other discussion from members of the EPG?
Oh, I have my hand up.
Commissioner Merman, you recognize.
Thank you. And I do want to thank Mr. Merrill and the staff, the Parks and Rec staff. They did their due diligence and work. And I think to slowly phase this in is appropriate, kind of matches what the governor is doing. And we'll just see how things go. And hopefully the public will adhere to social distancing, not congregate, keep their groups to 10 or fewer. Mr. Merrill, will there be signage? There will be signage along the ways at the parks.
Yeah, there will be Oops, sorry. There will be signage, and there will also be sheriff's patrols and others there to enforce.
Great. Thank you very much.
Okay. Commissioner Overman, you recognize.
Thank you, Chair. I just have a real quick question. In our orders, as well as the governor's orders, there's some guidance on daycares. And if many of our businesses that are able to open under the new phase 1 procedures, there are some strict guidelines on how daycares open. And that's one item. And then 2, what happens to the single mom that has to go back to work now that may or may not have access to daycare, since our daycares are being told they are to reserve space for our essential personnel. So I'm curious about what guidance we give our daycares that have not been able to operate. There are very strict guidelines on how they can operate. So I'm just curious, do we have guidance for the daycare business now that the schools are closed and people have in those essential services or businesses that are now asked to open up? What happens to that worker when they may or may not have access to daycare?
Who wants to answer that question?
I can possibly help, Commissioner Merman. As a member of the Early Learning Coalition, I know they've been working hard with the Children's Board, with Angela Chowning, who runs our child care licensing at Hillsborough County. There is monies available to provide free daycare to, excuse me, first responders and healthcare workers, essential workers. More or less, but also they're getting ready to open up and help fund the opening of many of the child care centers. And so I guess what I'd like, and maybe Mr. Merrill, you could direct Angela Chowning in collaboration with the Early Learning Coalition to bring a report back to us next Monday on what's happening. But that's kind of an overview of what's going on. They are trying to get them open.
Did I answer your question, Commissioner Oben?
Yes, thank you.
Okay. Commissioner Merman, you recognize. Commissioner Merman, you recognize.
Oh, no, I meant to take my hand down.
Okay.
I think I did.
All right. So any other would like to, any discussion from any other member? Discussion from any other member? Commissioner Merman, your hand's back up. You want to say back up something again?
There must be something wrong with it because it's definitely lowered on my computer. Sorry. It's
okay.
Down.
All right. Okay. All right. Well, seeing no further hands up today now, I want to wish everyone have a safe weekend. Take care of yourselves, and we'll be back here on Monday at 1:30. See no further discussion. We adjourn.
Mr. Chair.
American values, but American institutions.
Well, thank you very much, everyone. This is a great honor. And I see you have social distance on your mind. And that's a very good thing, Jovita. Congratulations. Tremendous job you're doing. I want to Thank everyone for being at the White House, a very special house, a very special place, no matter where you go in the world. I love the White House, and being here in the East Room of the White House in particular, where so many important functions have taken place over the years. And today we're really celebrating American workers and small businesses, and we've done a job for you, and we're going to make it so as we open up our country, you're going to be in good shape as opposed to be either losing your business or how do we get some people to work here, especially since your employees were so good over the years, and those are the ones you wanted. So we made that possible for you. We're delighted to be joined this afternoon by representatives of several incredible small businesses from across our country. Also with us, our Treasury Secretary, Stephen Mnuchin. Steve, thank you very much. And SBA Administrator. You've been busy, Steve, by the way? A little bit, right? Broke every record in the book. And SBA Administrator Jovita Carranza. Thank you, Jovita. Have you gone to sleep in the last 2 weeks? I don't think so, right? You broke every single lending record, numbers of loans, amount of loans, small business. It's actually a very big business when you think about it. Thank you very much, Jovita. Great job. As our nation battles against this terrible scourge, we continue to pray for the victims as well as for those Americans who are grieving their lost ones and their loved ones. There's never been anything like this. We suffer with one heart, but we will prevail. We're coming back, and we're coming back strong. We built the greatest economy anywhere in the world 2 months ago, and we're going to build it again. We're going to build it fast. It's going to go very quickly. And Larry, thank you for being here very much. You see what's going to happen. I think you have the same feeling as I do. It's going to come back very fast. Now that our experts believe the worst days of the pandemic are behind us, Americans are looking forward to the safe and rapid reopening of our country. Throughout this ordeal, millions of hardworking Americans have been asked to really make tremendous, tremendous sacrifices. It's sacrifices like nobody thought would even be possible. Nobody thought would ever be talking about something like this. This virus has inflicted an enormous and painful toll on our nation's workers and small businesses. That's why last month I asked Congress to pass the Paycheck Protection Program, giving small businesses emergency economic relief to keep workers on the payroll. 4 weeks ago, I was proud to sign it into law. We did that at a great ceremony with many of the people here and the officials here, and it was something. And I can tell you, I'm going to ask Steve to say a few words, but the kind of numbers and the kind of jobs they've done and the kind of jobs that have also been saved, it's incredible. You'll be seeing that in the coming weeks. The Treasury Department and the Small Business Administration launched the program in record-breaking time, just 1 week, and in the 14 days following its launch, we processed as many loans as the SBA would typically process in over 14 years. So in 14 days, they did more work and more loans, both in terms of applications and in terms of dollar amount, than they did in 14 years. 14 days, 14 years. Easy one to remember, right? That's some record. The first round of funding provided more than 1.6 million small businesses with over $340 billion so that American workers can retain their jobs, receive their paychecks, and help our economy take off quickly once America reopens for business, which is happening right now as we sit. We're going to be all set. You all ready? I know you are. I talk to you back there. You're ready. You folks are ready. Our swift action supported or saved 30 million American jobs at least. And last week, Congress answered our call to replenish the program, and I was honored to sign an additional $320 billion for American workers into law. At least $60 billion are reserved for community financial institutions, including those that serve minority and distressed communities. And that's also, when you think it's African American communities, it's Hispanic American communities, it's Asian American communities. We began accepting applications for the second round of funding yesterday. Demand is extraordinarily high, and there are already twice as many users accessing the system as on any day under the first round. And one of the things that the Secretary of the Treasury told me is that the amounts are much more loans at much smaller amounts. So we like to hear that because we're looking at the small amounts, the smaller businesses, and that's what we want. Nonetheless, we're processing loans at a pace never achieved before. In the first 24 hours of the second round of funding, we've handled over 30% more loans than any previous day of the program. So far, we've processed an amazing 450,000 loans totaling over $50 billion. That's in phase 2. That's incredible. Along with Administrator Carranza and Secretary Mnuchin, Ivanka has played an essential role in spearheading this important program. Incredible role. That's what she wants to do. She wants to help people. From the beginning of my administration, Ivanka has used her experience as an entrepreneur to fight for the American worker. She's created many jobs. That's what she did when she first came in. She just wanted people to be able to get jobs and job training. Went to the biggest companies anywhere in the world that are located in our country, and they would take hundreds of thousands of people and train them. And I think you got up to almost 15 million people, right? 15 million. She started off with a goal of 500,000. She wanted to get 500,000, and she is now on almost 15 million people. And I'd like to ask, if I might, Ivanka, to say a few words as to what's exactly happening today, what's happening over the next week, and what her views are for what's going to happen over the next period of time. It's going to be something I think it's going to be very special and bigger and better than anybody really understands. Let's see if I'm right about that. Ivanka, please.
Well, thank you, everyone, and thank you, Mr. President, for convening this incredible group of entrepreneurs and small business owners who very much represent the soul and the spirit, the grit and the tenacity of America's small business owners across the nation. So we're grateful to each and every one of you for joining us here today, and very excited to hear your stories and hear specifically about how you're going through this challenge and how through the Payment Protection Program and through the PPP, you are able to keep your workforce employed. It's about your businesses thriving and growing within your communities. It's about your workforce, who each of you cares very dearly about. And I'd like to make a special call out of thanks to Secretary Mnuchin for his tireless work on this front. So if you'd like to come up and join us, we would appreciate that, Secretary. And SBA Administrator Carranza, thank you. You have been such a champion for America's small business. If you'd also like to come up and join us. And Larry Kudlow, thank you for all that you do in fighting for American workers. With that, I would like to kick us off by introducing Amy Wright to come up to the stage and share with us a little bit of her story. She has created an amazing business that stemmed from personal experience and very much her heart. And it's been an honor getting to know you, Amy, as you really embody the spirit of small businesses around this country. Amy, because of the PPP program, was able to rehire the 120 workers that she was forced to lay off. And now those workers, all of which have some form of disability, are able to bring cheer and bring comfort to your clients as you're serving them. So Amy, if you'd like to come up and share your story. And Michael, her great colleague, is here today as well, who could share his perspective. Thank you, Amy.
Thank you, Ivanka, Mr. President. I'm so honored to be joined by my employee, Michael, who you will hear from in just a moment. Biddy and Bo's Coffee is more than a coffee shop. It's a human rights movement. We employ 120 people with intellectual and developmental disabilities, and for most of them, it's their first paying job, which made the decision for us to temporarily close all 5 of our shops especially difficult. But thanks to the Paycheck Protection Program and the incredible team at Live Oak Bank, All 120 of our employees are back on the payroll today and working from home, writing handwritten notes that we include with each online order we ship. I know everyone is ready to return to normal, but I believe it's time for a new normal, one where people with disabilities are valued, especially in the workplace. As a recipient of the PPP loan, we will continue to take up the charge and help everyone, especially people with disabilities, pursue the American dream. And Michael, would you like to say?
Sure. I just hope the scene isn't too big for me. So to you, President Trump and Ivanka, thanks a lot for inviting us. Thank you, Mr. President, for having us. I love my job, and I am excited about going back to work. At Bauhaus, we like to use the phrase called not broken. That means me and all my amazing coworkers are not broken, and we have lots to offer. I know the great country of the United States isn't broken either. So on behalf of myself, Megan, and Amy, and all the employees of Bauhaus, thank you for inviting us over.
Thank you very much, Michael.
You guys are a family. Love you guys.
That's better than we did. Much better, Michael. You did a better job. Thank you very much. That's beautiful. Stick around. You get to hear the press ask some questions, and they'll probably be a little bit nicer if you're in the audience, right, Amy? That's pretty good. Also, I'd like to ask Tony Stafford, Chief, sort of the boss, I guess you could say, chef and founder. You're the boss, right? Wouldn't you say? Of Ford's Fish Shack. And I hear it's good stuff. How about explaining, please? Best? Oh, I'll have it. Be careful. Thank you. Come on up, please.
Thank you. I'm here representing, well, thank you, first of all, for inviting Mark, my great employee, with us. We're here representing the restaurant industry, which has been really hurt hard by this with the closures and things like that, so I'll keep it brief. I'd first like to thank the President and the Vice President for leading us through that pandemic. It has devastated our restaurants. Over the last 6 weeks, my 3 restaurants have been devastated. Dining room closures, had to furlough over 100 people. That was an incredible hard phone call to make about 6 weeks ago and tell the employees I've never had to lay off a single employee that I just don't have a space for you. We just don't have, the restaurants are closed, and it was just extremely hard, and it was very emotional, and it was one of the hardest choices I ever had to make. So it was tough, but I promised every employee we would do our best to bring them back, and we would fight every day tooth and nail to get them back into the restaurants and be successful like we were the 10 years before all this terrible stuff happened. And now with the help of the PPP loan and the success of the PPP loan that we were able to get, I'm going to be able to keep that promise and bring every one of those employees back. So thank you, Secretary Meduncha. Thank you. And it's been awesome to be able to tell them that we're going to weather this storm, we're going to get through this, and we're going to be stronger and more agile once this is over. The one thing that you can see with the restaurants, we're surviving out there. We're doing things that we didn't do before with carryout and curbside and delivery and all those meal plans. Those things are awesome to see my fellow industry leaders out there doing in the restaurant industry. So I commend every one of those restaurants that's fighting to survive out there. And so thank you all for that. We will get through this. We will welcome our guests back, and once our state opens up, we'll welcome them back and thank them for their support through all this. I have amazing stories of guests coming into our restaurant the day after the closures to just give us tips, give us cash to give to our employees we had to furlough. So those great stories, that will not be forgotten from any of our guests. So thank you for that. And I look forward to the one day when all restaurants and all small businesses can reopen and be as successful as they were before. So thank you very much. Mark?
Fantastic.
Thank you.
So my name is Mark Underwood. I am an employee of Ford's Fish Shack, so I am a living example of what your plan has done. I'm a husband, father of 5. My mother lives with me. And just listening to Tony talk about that day when the layoffs happened, it's a little emotional. But with the PPP, it has now given life to my family. It has injected hope in our business. and it's allowing us to fight the fight. So I appreciate it from everybody on your team to help us get through this issue that we're going through. So thank you very much.
Help you.
Thank you.
Is he a great chef or a good chef?
He's a great chef. Thank you very much. Thank you.
Thank you.
Larry.
Thank you.
That's great. That's a great story. Your mother lives with you, 5 children. That's a great story. So that was a rough day, right? Wasn't it? Huh? It never happened to you before, probably. Yeah. Happened to a lot of people. It never happened before. So, but we're bringing it all back. You know, there have been a couple of places that have opened, and I don't know if you saw this, Tony. They have some restaurants, and they have lines that are very long to get in. People want to be back. They want to come back. We're going to bring a country back. They want to get to work. And I know you were in that category very much, so it's great. Thank you, fellas, very much. Jackie Crick, CEO and founder of ECU Communications. Jackie, please. I'll move that down, Jackie.
A little short, so.
I'll get in trouble for touching it. They'll say, he touched the microphone. What am I going to do?
Thank you, Mr. President, Ivanka, Secretary Minuchin, and Administrator Carranza. It is a pleasure and an honor to be here. My name is Jackie Crick. I'm originally from Bogota, Colombia, in South America. Yay. And I've been here many years, and a big part of those years that I've been here, I've been CEO of ECU Communications, which I founded 16 years ago. We focus on advertising and marketing with niche products for diversity recruitment and outreach programs. But more than anything, we're a woman-owned small business, minority-owned 100%. So just like many of the stories that I've heard before me, and I'm sure the ones that are coming, we are concerned about the future. And being able to get that PPP loan has given me and my staff a little peace of mind to know that we're going to be okay. Just at the end of February, I hired 3 more staff members. We're 30 now. So when we heard the news about going home and working from home or not being able to work from home, you know, the first thing that goes to your mind is, how am I going to support or tell these folks that they need to go? Being able to get the PPP loan has given me the ability to have that peace of mind that I'll keep them, their treasured staff, and I'll be able to continue to focus on my program. Thank you so much for what you do, for your leadership. Thank you.
Great job.
Thanks.
Thank you, Jackie. Great job. Chris Stansbury, co-founder and partner, West Virginia Eye Consultants. I like West Virginia, you know. I like it. We'll put that up.
They like you, sir.
I like it. They like me, too.
Thank you, Mr. President. Thank you, Ivanka, Mr. Secretary, Madam Administrator. Appreciate the opportunity to be here today. It's just an honor and a privilege as a small business owner. It's very meaningful to have this opportunity. My company is called West Virginia Eye Consultants, based out of Charleston, West Virginia. And we started in 2011, and we had 2 doctors, 1 employee, and 1 location. And over the last 9 years, we've been blessed with a lot of growth. We've worked hard. And in February, we celebrated our 9th anniversary with 7 locations, 7 doctors, and almost 60 employees. So it's been a great ride. But just a month later, thanks to COVID-19, we shut most of it down. And my partners and I were just overwhelmed, just bewildered. We weren't sure how we were going to survive this. But thankfully, Congress passed the CARES Act, and President Trump signed that into law. And as part of that, the PPP loans became available. And my partners and I applied for PPP loan through the SBA, and we were so gracious and so thankful to receive that, because it's been a lifeline for us. As soon as we received those funds, we were able to start paying our utilities, our rent, and start bringing some of those employees back that we need to get staged to begin to reopen the economy. And so we're just so grateful for President Trump's leadership and Congress for working with him to get us through this crisis. So thank you so much, sir. We appreciate all your help. Thank you.
So you do eye examinations, doctor?
Yes, sir.
And you do glasses and all that? I may have to see you. okay? I guarantee you're probably better than these high-priced people. I used to see the highest priced, and they were not the best. I'll bet you're better than all of them. So I may have to see you, doctor. I'm serious about it. We can do something quickly, all right? You move quickly too, right? No long meetings. Good. I may have to see you, doctor. Thank you. Tissa Clark, President and CEO, J.D. Clark Professional Services. J.D. Clark. Hi. Come on up. Please.
Thank you, Mr. President, Ivanka, Mr. Secretary, and Madam Administrator. I am Tissa Clark, President and CEO of J.D. Clark Professional Services. I am a general contractor and property maintenance manager for the affordable housing, hospitality, as well as our government agencies, particularly our nonprofits. Most of my employees are the underserved, underemployed, or unemployed. And having the opportunity to be able to apply for a program such as the Paycheck Protection Program allowed me to keep those individuals employed. As a small business owner, my company is based out of Prince George's County, Maryland, and I've been in business for 12 years. And as a small business owner, we never want to fire or lay off, and even to the extent of ourselves not receiving a paycheck. And so I forgoed my paycheck until I could get funds. And so now with the funding that we received via M&T Bank on last Monday, it has allowed us to continue to pay our staff and for even myself as the business owner to once again take a paycheck. So this program is phenomenal for our small businesses. Also, as a side note, Madam Administrator, I did also apply for the Economic Injury Disaster Loan, and I did receive my advance on Tuesday of last week. So these programs are very critical for the small business community, but I do believe that we as small business are strong and we are resilient and we will bounce back. Thank you.
Have you ever thought about running for office? You could do it very easily. You are something. That's a very good job. Thank you very much. Luke Bernstein, Executive Vice President, Chief Retail Officer, and Chief Communications Officer for Orrstown Bank. Come on up, Luke.
Thank you, Mr. President. Ivanka, Secretary Mnuchin, Administrator Carranza. I'm Luke Bernstein, proud to be here representing Orrstown Bank. I'm proud of our board, I'm proud of our entire team, and I'm proud of my fellow community bankers throughout the country who've rolled up their sleeves and worked tirelessly to help communities working around the clock and helping them gain access to paycheck protection funds. Orrstown is a small 101-year-old community bank based in Pennsylvania and Maryland, and in just 14 days, we were able to process approximately 1,500 paycheck protection loans totaling $370 million. In those 2 weeks, Orrstown processed more loans in total amount than we did in an average year last year. We did more SBA loans in 14 days than in our entire 101-year history. Why? Because this is about the communities. This is not about Orrstown Bank. This is not about banks. This is about people. The stories you're hearing today. This is about what's going on Main Street. The stories of what's happening with the Paycheck Protection Program are not only heartwarming, they're inspirational. We're helping pizza shops, delis, healthcare workers, repair shops, construction companies, and countless others get access to these funds. These people need this money. They're getting a lifeline through this program. Every job is life-sustaining to someone, and the PPP is saving the livelihoods of those in our communities. We want to thank you, Mr. President, for your leadership during this extraordinary and unprecedented time, and for partnering with community banks and Congress to help us and give us the opportunity to do what we do best, and that's serve our communities through the good times and the bad. You have unleashed the innovation of the private industry, and we are going to respond. We also want to thank Secretary Mnuchin and Administrator Carranza and Congress for supporting this program and giving the opportunity to community banks around the country to join together and help those in need. With this program, we can do that. Thank you, Mr. President. Thank you.
Thank you very much, Luke. That's a beautiful job. Brandon Hudson, President, Ed and Jim's Body Shop. I know what that means. I'll bet you fix beautiful cars. You make them beautiful, right? I'll bet you do. Please come up.
Thank you, Mr. President, and Ivanka, Secretary. And instead of celebrating on our anniversary on April 1st of being in business, we began furloughing employees. So I would like to take the opportunity to thank President Trump for quickly signing the PPP into action. Because of this program, Ed and Jim's is able to rehire all of our furloughed employees and provide them with a paycheck starting this week. This program has given our small business the funds needed to operate and maintain through this crisis. With everything we've gone through, I can't extend our thank you enough to President Trump for everything he's done for small businesses like us in the automotive industry at a time where our business really depends on people leaving their house and driving. So, Mr. President, thank you very much for what you've done for us and the industry. Thank you.
Thank you. And what do you do with cars? Explain.
Our businesses, we repair cars. We're a collision repair shop, Parkville, Maryland. So we work with a lot of insurance companies. We have walk-in customers. So if you get into an accident, unfortunately, we're here to help you out.
Can you generally fix, like when there's a problem with a car, can you generally fix it without sending for new pieces? Or do you generally have to put new pieces on if it's a big collision?
It depends. On a big collision, we're mostly probably replacing some stuff, but we can repair a lot of things. So, we've been fortunate enough that we are able to repair a lot of things, but, with the demand for manufacturers to move to producing other things such as PPE and things like that, we're a little nervous about what that means for the future for us right now. But, we know you'll do the right thing for us.
After today, you'll have a lot of customers.
We appreciate you, sir. Thank you.
Thank you very much. Thank you, Brandon. Thank you, Brandon. Allie Mills, Executive Vice President, Plum Contracting, Inc. Would you like to have, come on up here. He was so good. Put that mask on the way you had it. He was.
Thank you, President Trump, Ivanka, Secretary, Madam Administrator. I am here representing the highway industry. Plum Contracting is a third-generation union highway and bridge contractor in Pittsburgh, Pennsylvania. With Pennsylvania's winter construction shutdowns, we have been left with little revenue coming into a new season. COVID-19 abruptly halted all highway work on March 16th in our state. With very little revenue at this point of the season, we were forced to sadly lay off a majority of our employees, about 125, which included trades and management. There were a lot of sleepless nights and fear of losing it all. The Payroll Protection Program was and remains the engine that is carrying our business through this shutdown. We wouldn't survive without it. With our PPP approval, by May 1st, we anticipate our company running at full capacity when the highway industry is permitted to return back to work. We applaud you, Mr. President, for your interest in the welfare of America's small business and the American worker. And thanks to all that, my company will be here to work on a big infrastructure program very soon when you're ready to do that. Thank you. Thank you.
I was with Governor Ron DeSantis of Florida, which is interesting from your standpoint because we talked about the business that you're in, and he noticed that right into the immediate shutdown, he noticed there was very few cars on the road, and he did very opposite of what a lot of governors did. He said, "This is a great time to fix our roads and highways," and I said, as soon as he said it, this was in the Oval Office 2 hours ago, he said, I noticed there was very few cars, and isn't that better than fixing them during rush hours and when there's traffic and when it's booming, like hopefully over the next few months it's going to be again, just like it was before, the best we've ever had, and then we had to close it down. So he's fixing roads and bridges and doing a tremendous amount of work during this period of time, and I thought it was very smart. So it's a little bit the opposite, but to each his own, right? To each his own, but it made a lot of sense to me when I heard it. I'd like to ask Secretary Mnuchin to come up and explain just a little bit about how well it's going, how the kind of numbers, the kind of records, to a point where there's never been anything like this, loans coming in, and how the loans are actually smaller than in phase one, and that makes us happy because that means smaller businesses, and that's where that's what we're looking at, that's what we're aiming at this time. Please, Steve.
Thank you, Mr. President, and Ivanka, thank you for putting this together. Your stories are the stories of the 60 million American workers that are going to have the benefits of the close to $1 trillion that the President and Congress have invested in small business to protect you and put you back to work. That's over $650 billion in the PPP. That's over $300 billion in disaster loans, and that's over $20 billion of grants. And I know the press has commented on a lot of big companies that inappropriately took the money, and we've been very clear. We announced today that any loan over $2 million will have a full review for forgiveness before they're repaid, because this is the story of small business here. And I am so pleased to see how this is working. So thank you, Mr. President. I'd also just like to comment, we're going to be up to close to 120 million of direct deposits and checks for the economic impact payments. If you have not received it yet, please go to irs.gov, get my payment. We made some corrections to the website over the weekend. Please go on and check your payment. If you haven't received your payment, upload your information so we can get you the money. The combination of the direct payments, the PPP, the disaster loans, and enhanced unemployment insurance is the investment that the President has made in American business and American workers. Thank you, Mr. President.
Thank you very much, Steve, very much. And on the enhanced, thank you. And Steve, on the enhanced payments, we're really looking to the state to give that out. And unfortunately, some of the states have very old computerized equipment from many generations ago. But they have the money to give out, and they'll give it out as it comes, and hopefully they'll be able to do the job. Some states have been very efficient, and others have had a hard time, but you'll work with the ones that have had a hard time. But we rely on the states, and we are relying on the states to get it out as quickly as they can, considering especially some of the equipment they have. Maybe now they'll be able to buy new equipment, right? When we get all finished, we'll have nice new computerized equipment so they can do it. With that, if you'd like to ask a few questions, I think this would be a good time, because with these incredible people, this is the media.
And Donald Trump. Let's listen in. This is a roundtable.
Who have been truly great business leaders and are great business leaders. And you're opening up your company again, too, if you think about it, right? You're sort of doing a reopening, but they're great companies and they'll do very well, hopefully better than ever before. And that's what we're seeing. We're seeing tremendous pent-up demand, and it's a beautiful thing to see. So it's wonderful to have America industry leaders, and that's what you are, true leaders, to the White House. You've been here before, all of you, and we've talked about it in different times. We built the greatest economy in the history of the world, and nobody even disputes that. And one day they walk in, they say, sir, we're going to have to close it up until we get rid of this hidden enemy, this terrible scourge. And that's what we did, and we did the right thing. We did an incredible job. We worked with the governments. We worked with states all over the country. We had no ventilators, or very few, from previous administrations. And we became the king of ventilators. We have thousands and thousands of ventilators. We're now helping other countries with ventilators. We had old-fashioned tests that didn't work. They were really obsolete. They didn't work. They were broken. And we end up, the testing has been incredible now, and to a level that nobody's seen. I got a call from President Moon of South Korea. He said, congratulations, your testing is just, nobody's ever seen anything like we're doing. We've tested more than all countries put together, and millions of tests, and the highest quality test. but it's great to be with you. We're joined by Matt Maddox of Wynn Resorts, Chris Reynolds of Toyota, Chris Nacetta of Hilton, Josh Bolton of the Business Roundtable, Walt Immer of Waffle House, and thanks to Vice President Mike Pence, Secretary Steve Mnuchin, and Secretary Eugene Scalia. That Scalia has very good genes. Where's Scalia? He has very good genes, that guy, I'll tell you. Scalia, he's got the Scalia genes, right? We all know what that means. We mourn, and I have to say this so strongly, we mourn every life tragically lost to the invisible enemy, and we're heartened that the worst of the pain and suffering is going to be behind us. We think we really have crossed a big boundary, and much better days are ahead. And I often say I see the light at the end of the tunnel very strongly. This demand is going to be incredible. I think next year is going to be an incredible year for our economy. I think the fourth quarter is going to be really, really good. Kevin, we were talking about that before. You maybe will say something. And we're going to be in a transition quarter next quarter, the third quarter. And I think we'll do very, very nicely there from an economic standpoint. But thanks to the devotion of the American people, the number of new cases continues to decline. The United States has now conducted nearly 6 million tests, far more than any other nation, as I said. So many tests, and so much has been learned about what we're fighting. And if it does rear up a little bit in the fall, or even a lot, we'll be able to put it out. We'll put out the embers, or we'll put out the flames. 2 weeks ago, we released guidelines to give states a real strong indication of what we want and how we want it done. We've really had a good relationship with the states. Mike Pence has worked very, very hard with the task force. He's headed the task force, so importantly, with a great group of people. And it's just been incredible what's taken place over a very short period of time, including the gowns and all of the surgical equipment and the safety equipment and masks. People don't talk about masks anymore. That's the other thing. They're not talking about masks. They were talking about where are the masks, because we had a cupboard that was bare. We didn't have a lot of equipment or medical supplies in the cupboard that we inherited. Now we're taking in millions and millions of masks. I'll give you a number that you won't even believe we have in order. 500 million masks coming in, and we've delivered millions and millions and tens of millions of masks all over. So you don't hear about that anymore either. You don't hear about ventilators, you don't hear about masks, and you shouldn't be hearing about testing, but that's the last thing they can complain about, I guess. You know, if we do 2 million tests, they said, how come you didn't do 3? Well, we do 3, and then they say, how come you didn't do 4? That's like a dream for the media. But we've done incredible with testing, and you'll see over the next coming weeks, Mike, you may want to speak about that a little bit, but over the next coming weeks, you'll see some astonishing numbers. I don't know that all of that's even necessary. You have some governors that love the tests. You have others that like doing it a different way, an old-fashioned way, with some testing, but we're going maximum testing. We've encouraged the more than 30 states that have taken steps to resume economic activity already. We've given them tremendous encouragement and support. We're backing them 100%. You know, many governors have called me, telling me their plans, laying them out. Governor of Texas, Oklahoma, governor of Arkansas, many, many governors. I spoke with Governor Cuomo. We had a great talk today on a different subject, but he wants to get open. Everybody wants to get open. They want to get open, and they want to get back to business. And their constituents, the citizens of this country, want to get back. And that's what's happening. So I just want to perhaps start off by introducing our vice president, and then we'll go around the table, and you'll introduce yourself and say a few words to the media. You're covered by very serious media out here. The audience can't see it, but these are the most wonderful human beings. Actually, this is a nice group. I can't imagine. We actually have a nice group of people. But Mike, if you could say a few words, please, that would be great, and then we'll go around the table. Thank you.
Well, thank you, Mr. President. I want to thank all the distinguished business leaders who are here and the literally millions of Americans that are employed at the businesses represented around this table. It's remarkable to think, Mr. President, that before the coronavirus epidemic came ashore, we had seen extraordinary growth in the American economy, not just the stock market setting records, millions of new jobs, more Americans working than ever before. But in January, when you stood up the White House Coronavirus Task Force, you said we had one mission, and that was to save lives and to make sure that that the healthcare providers in America would be able to render the level of care to any American struggling with the coronavirus that we would want our own family members to have. And thanks to your leadership, thanks to the partnership that we forged with states across the country, working with local health officials, Mr. President, as you said yesterday, we have light at the end of the tunnel. We really are encouraged by the progress in even the hot spots around the country. Cases are leveling off, and in some areas going down. Hospitalizations are declining, even in the greater New York City area. That's a testament to the American people, to the way the American people now nearly 45 days ago embraced the guidelines to slow the spread. And as we come to the end of this mitigation period, states across the country have all embraced those same mitigation and social distancing efforts. The American people have put them into practice. We've saved lives. We've protected the vulnerable. We've preserved our healthcare system, and we're well on our way to healing our land. As you mentioned, testing will be a part of how we move to the next stage. It was just on the 16th that you laid out a plan for opening up America again. And as we sit here today, I'm informed that 35 states have already released formal opening plans, many of which are consulting directly with our team here in the administration, and we're going to continue to work with all of them. Testing is a major part of it, and I can assure you, Mr. President, and the American people that we'll continue to scale testing across the country. We're doing more than 1 million tests a week now, 5.8 million tests total. We expect by next month very quickly to be at a capacity to do more than 2 million tests a week. We laid out our blueprint for testing, and as I heard again today on a conference call with America's governors in agricultural states, there's great enthusiasm for the blueprint for testing that you unveiled earlier this week, and we'll be surging supplies and resources and reagents into the states to support that increased testing. But we know that ultimately we've got to find a way to help America get back to work, and having the opportunity to hear from these business leaders about best practices that businesses are considering, whether they be restaurants like Waffle House or major corporations and hotels. We welcome that. We look forward to partnering with you, as the President said. America works when America is working, and we're absolutely committed, as soon as it is safe and responsible to do so, to partner with governors across the country, partner with businesses across the country, and open up America again. So thank you, Mr. President.
Thank you very much, Mike. And just before we go around, Puritan Medical Supplies, a wonderful company, will produce 40 million additional swabs per month starting in May. They've opened up a very big process, and that was funding authorized by the Defense Production Act. So that'll help the states. And again, we're there to help the states. A lot of states can buy their own swabs. It's not that big a deal, but we're here to help them. We want them to be successful. We had, as you know, the governor of Louisiana in today, and we told that story, which has been a really great story. And we had the governor of Florida in yesterday, and that was a great story. These were just incredible what's been happening. So maybe we'll start with my left. And Chris, you want to take it and tell them about you? I know a lot about your company, but maybe a lot of people don't. Tell them the story.
Indeed you do. Thank you, first of all, for inviting me back to the White House. I was thinking on the way down here today, I'm based in Washington, and I was here about 6 weeks ago. The world was a different place. We were not at the beginning, but we were in the thick of it fighting this war. And we've come a long way. We've made tremendous progress thanks to your leadership and the leadership of the administration that's represented around this table and otherwise. So thank you for that. We are very supportive as an industry and certainly as a company on reopening America. We think it's critical that that happen. The guidelines that you and the administration have outlined We are incredibly supportive of opening in a safe and healthy way, which you and Vice President Pence just described. We have been trying at Hilton and as an industry to be part of the solution throughout. So in the middle of the crux of the crisis, when first responders were unable to get housing, even though our industry and our company has its share of problems, we provided with American Express 1 million rooms free of charge to first responders. Those rooms are still being provided to first responders as they fight the war. But now as we think about, and I spend my time predominantly on the reopening of our business, what we realize is that people do want to get out. They want safety. They want to be doing it in a way that is safe. They want to feel good about it, but they want to get out. They want to visit their family, their friends, their loved ones. They ultimately want to get around the country and do business again. And in order to do that, they want to feel safe. So all the work that you all are doing is obviously, as an administration in the states, is critical. What we're trying to do in our part is develop the best health and hygiene standards that exist. So when they stay in our hotels, they feel safe. So what we launched just this week was in a partnership with Lysol, one of the most respected brands with some of the best scientists on cleanliness and killing germs, and the Mayo Clinic, one of the most reputable health organizations in the world. We have developed and are working on the absolute best protocols so that when people come into our hotels, the rooms have been cleaned, they've been sealed, the public spaces have, and that they can feel safe and secure in that environment so they can get out and see the people they want to see and see this great country again like they used to. We've also been trying to work with the industry, and industry, to their credit, is trying to mobilize to create a consistent set of standards so that this isn't just Hilton. The whole industry, would have a set of health and hygiene standards that would make people comfortable. We will be sharing it with the administration, sharing it with governors already to try and create a standard. We stand ready as Hilton, and we stand ready as an industry to help get America open and moving again.
That's great. Thank you very much. Great company, and you'll have it up and running again very soon. I know you very well, and you're going to do a great job reopening. We're reopening Hilton, and we're reopening our nation. A lot of companies are very excited right now. Steve, do you want to say just a couple of words about where we are with the different things, please?
Well, I think, thank you, Mr. President, Mr. Vice President. It's great to see these companies here today. It's great to see the reopening. I think we're making an enormous amount of progress. Yesterday, we met with small businesses that we saw the benefit of the programs. Today, we're meeting with big businesses. I was particularly pleased to hear from Chris. He's been able to access the capital markets. Just the announcement of our facilities with the Federal Reserve created liquidity so that public companies could access the capital markets and not need to come to the governments for support. Thank you.
Thank you very much. Please, how you doing?
I'm doing great. Thank you, Mr. President. I'm Walt Amer with Waffle House in Atlanta, Georgia. It's an honor to be here today. Thank you for including me, probably a well-dressed cook and dishwasher. I don't know about big companies, but we're happy to be included. And thank you too, Mr. Vice President, for all of your support. I am here representing our industry, I believe, and in large part the independent restaurant companies of America that are out here that have helped create the fabric of our country with the restaurants that they've put in our communities and the connections they have to the communities. And we, in a small way, feel like we are a part of that. We did have the opportunity this week in the state of Georgia and the state of Tennessee to open up some of our dining rooms to dine-in customers again. And it was very welcomed by our people. It was welcomed by our customers. Our customers are ready to see some sign of progress that we are beginning to move forward. We've done it in a safe way. We have followed all of the guidelines, your guidelines, the CDC guidelines, and how to make that happen. But what we believe when we started out on this journey, we said we really have several goals. And the first goal was we wanted it to be a safe environment for our customers and for our associates. And our second goal was to create financial safety for our workforce. And I wanted to thank you personally on behalf of our workforce, for all of the stimulus funds that have gone directly to the workforce of America. It is making a difference. It has made a difference. It is keeping the economic engine turning ever so slowly right now, but it is helping keep people put food on their table and a roof over their heads. So on behalf of our workforce, I thank you for that. As we got into this, we felt like we needed to make a lot of adjustments coming in. One of the great things about a restaurant and the entire restaurant community, the restaurants are the second largest private employer in the country. And there is 1 million restaurants out there, and probably no other industry has been hit as hard from a revenue standpoint or a layoff and furlough standpoint. But restaurants, if you think about it.
What's number one?
What's number one? Healthcare is my understanding.
Really? Good.
Yeah, private employers. I assume you guys are number one overall. But so, you know, restaurants have a unique opportunity to help lead us out of this. And the reason for that, in my opinion, is that we have been practicing safe food handling for years. The safety of our guests has always been paramount. So what we have done is we've taken a workforce that is trained to do that and added more sanitation practices to it, more touch points, more social distancing as you have prescribed and the CDC has prescribed. And we have basically turned our restaurants into the ability pretty much at half capacity to seat guests in our restaurant. And it's given us an opportunity to get the wheels of the economy, our engine turning a little bit, because the next thing we want to make sure is we protect the jobs for the people that work for us and the people in our industry. So we're very appreciative. I did want to say that ever since my daughter was young, she every time she saw the WH on the TV screen, she thought that stood for Waffle House. So I don't know if you have the trademark for the WH or we do, but we could probably work something out if I wore my WH tie for you today.
This one was here first. I know.
Well, we might have to talk then. So, but thank you for including us, and on behalf of all the restaurant operators out there in the country, we appreciate this opportunity to begin the journey to move forward.
And thank you very much, Walt. We appreciate it. Chris Reynolds. Chris of Toyota.
Yes, Mr. President, thank you first for inviting us. Thank you, Mr. Vice President, and giving us an opportunity to share how Toyota is working within the American automotive industry to return to work safely, to reopen America safely. We announced on March 18 that we were suspending production due to the awful scourge of the coronavirus. On March 19, we started to plan to reopen. We started right away. And just to give you some quick background on Toyota, we've been here in the U.S. for over 60 years, 1,500 dealers, 1.2 million units of cars and trucks manufactured last year, 475,000 people employed, including a great number in the state of Indiana, from where our Vice President is from. Going to the next slide, we, with that as background, really are trying to apply 3 fundamental principles to how we're going to return to work. Principle number 1 is we need to stay connected with our team members. So every week we conduct phone surveys with all 32,000 of our factory workers, asking them how are they feeling, what's their health, what's their family's well-being, what's their confidence level in returning to work. And we also preview with them all of the new safety protocols and processes that we're going to put in place. We share pictures of the reconfigured factory workplace so they can have confidence that we're doing everything possible, Mr. President, to keep them healthy, safe, and productive. The second principle that we follow is that we've prepared our plants and facilities for safe and healthy working. So, like many here, we're engaging in marked off areas that require social distancing, the provision of masks and face shields where appropriate, daily temperature screening, as well as a daily app-based questionnaire that before you come into work asks you, how are you feeling today? Do you have any symptoms? So that we can try and manage and contain the virus. And we're using best practices not only from your own Center for Disease Control, Mr. President, but also from around the world to try and increase the safety and health of our team members as they produce. And then the third principle is we're not date-driven, we're data-driven. So our current plan is to open on May 11. It'll be a slow, gradual opening of our plants around the country, but we're flexible. Every plant will be different. We'll have staggered shifts. We'll do many other things to comply with the Centers for Disease Control guidelines. And our goal is to prioritize team member and health. Mr. President, one final point. We all know that our team members live in communities. It's not just the workforce that they're in communities. So what Toyota has done is it's tried to support the communities in which our team members live, including manufacturing 500,000 face shields just since the start of this crisis to distribute to healthcare centers, nursing homes, first responders around the country, so that our team members can feel that we're also part of the community. And we've also put together, just released yesterday, a community service announcement aimed at those communities of color that have been particularly impacted by the lethal nature of this virus. This announcement includes celebrities encouraging everyone to engage in safe practices promoted by the Centers for Disease Control. So we think it's a holistic process. We think it's also a process that requires commitment, and thank you for the commitment that your administration has demonstrated. We're going to get through this as a family, Mr. President. Thank you.
So, Chris, what's Toyota doing in Japan? Are they open? Are they semi-open? What's happening in Japan?
Mr. President, in Japan, the situation varies prefecture by prefecture. It depends on the plant. Some facilities are operating, some are not, and that's really a function of both the situation on the ground in a given prefecture like our state, or it's a function of demand. So it varies, sir.
Well, great job. You're going to have a great Olympics next year, too, by the way.
Thank you, Mr. President.
Really great Olympics. Thank you very much. Matt Maddox, please. Wynn Resorts. Hi,
yes. Thank you, Mr. President. First, I'd like to echo what you're saying about testing and testing capacity. We have seen a real expansion in testing capacity in Las Vegas, so much so that our university hospital is going from a couple hundred tests a day to 10,000 tests a day. They don't have enough people to test. So I signed a deal with them to allow all Wynn employees to get tests anytime for free, and they're going to set up on-site testing. So that's moving forward. We also, during this time, decided to pay all 15,000 of our employees, from housekeepers to head of sales. Right. And we did that because I thought that could help accelerate the economy. So as an example, we took our call center, and we've had our call center team up with the health district to become contact tracers. We tripled the amount of contact tracing ability on us for our state to get that moving.
Great.
And we published a 23-page plan for the whole world to see 10 days ago that lays out exactly what we think a strip opening would look like. We have thermal cameras at our entrances. We have company-supplied PPE. We have just about every UV technology that
We'll go ahead and call this meeting to order. If you would please join me in rising for the invocation and the pledge. Great God in heaven, ruler of all, we come to you at what we hope is an exciting time, a time where we can reopen Hernando County in Florida and the country as well in parts. And we thank you for this opportunity to discuss some of these things. I pray that you give us wisdom and insight. Help us to see some of the results or consequences of our decisions. And Lord, we seek you for that guidance. I ask it in Jesus' name. Amen.
Amen.
Commissioner Locke, would you please lead us in the pledge?
Certainly. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. I want to go immediately to the approval of the agenda. Entertain a motion from the board. Have a motion from Commissioner Locke, second Commissioner Champion. All those in favor, aye. Aye. So that it passes. And we are convened today to go through several things as you see on your agenda. I want to take just a moment and recognize our executive policy group that's with us today. We have Sheriff Al Nienhuis, thank you for being here, and Councilman Bernardini, thank you. Superintendent Stratton. We have the Director of the Health Department, Robin Napier, and then we also have the Director of Emergency Management, Cecilia Patella. So thank you all, and we'll have the opportunity for updates and comments as we go forward. So as you see on your agenda, we have item C, and I'm going to go ahead and turn this over to the County Administrator, Jeff Rogers. You're recognized.
Thank you, Chair and Board. To the gate for obviously the agenda is update of COVID-19 and review of the Governor Ron DeSantis' Reopen Florida plan. Prior to that, I want to go through a couple of things with the emergency policy group. We kind of do some updates, and so first thing I want to talk about is this is an emergency board meeting for the Board of County Commissioners. Anytime we do that, we need to just for the public's need why there's a need for this emergency meeting. The need for this emergency meeting is to review the Executive Order 20-112 by the Governor of Florida as provided yesterday by the Governor to including the Safe, Smart, step-by-step plan for Florida's recovery that takes effect. This takes effect next Monday, which is prior to our next board meeting. And I believe it was an emergency meeting need to call for you to review this and and make sure that you understand the issues of the executive order given by the governor on the county. And also, with the ability of having a quorum today, the Board of County Commissioners needs to meet to consider the extension of a local state of emergency, and that expires tonight at midnight tonight. So we have to meet today to have extend this local state of emergency, and with the ability of the board to meet for having a quorum, vice the chairman approving that on the guidance of the EPG, then we decided to have a board meeting today. So that's the reason why there's an emergency board meeting today for the public's notice. Secondly, I want to explain a quick explanation of the role of the emergency policy group is here today. Their role is about our county ordinances to advise the chairman of the Board of County Commissioners upon times when we're not able to have a quorum meet, or in emergencies when we don't decide to have the board meet to have directives. And so going forward, at this point, the Board of County Commissioners is able to meet within this event. So the Board of County Commissioners will be meeting to review the recommendation of the whether or not we should expend any local state of emergencies or any decisions made that should go to the Board of County Commissioners following the county's ordinance. So today, the Emergency Policy Group, while they are key stakeholders in the community, their job is to provide guidance and suggestions and for the Board of County Commissioners to make that recommendation. So that's why this meeting would be a joint meeting today going forward. Upon that, so I've combined those meetings today for an efficiency of having two meetings in the same day. One meeting is best for the public's notion, and so everybody has opportunity to meet, and public has ability to meet, and also have any comments on our meetings. Next, I'd like to have Robin Napier, the Health Department Director. She'll come up and give us an update on the COVID-19 situation within the county. Thank you.
Thank you. Hello.
Morning. Afternoon.
Good afternoon. Robin Napier, Director of the Health Department. Just give you a brief update on where we're at in Hernando County. So far, total tested to date was 1,687. At the Health Department, we tested 340 of that number, which is about a 5% positivity rate, which is great for Hernando County. Total cases in Hernando are 91, 85 residents and 6 non-residents, 5 deaths as of today. Hospitalized is good news. We only have 1 resident still in the hospital. Unfortunately, he is on a vent, but all the others were released or passed away, a couple, but at least most of them were released. In Bayfront, we do have 7, but they are non-residents. They are Sumter County Correctional related. So they aren't included in our counts. They are not. Of the 90 cases, 59 of those were epi-linked, which means they were part of a family or some household, and that's about 65% of those 90 cases. Cleared from isolation, which means at least 7 days since symptoms first appeared and at least 3 days since they had no symptoms, to date was 85. And of those, 55% of those were epi-linked, which is about 65% as well. So that's good news. So there's really currently right now